His Excellency the Governor Martin Roper, Honorable Premier Wayne Panton, Honorable Sabrina Turner, Minister for Health and Wellness, esteemed speakers and presenters, members of the Healthcare Conference Organizing Committee, ladies and gentlemen, good evening, and thank you for joining us for the 13th Annual Cayman Islands Healthcare Conference. My name is Ben Mead. I'm the Marketing and Communications Manager at Health City Cayman Islands, but I have the distinguished pleasure of being your Master of Ceremonies this evening and over the next 2 days as well. So thanks to the organizing committee for entrusting this duty to me once again. Now, we do have a packed agenda to get through over the course of this evening and the following 2 days, with a lot of pertinent information around the conference theme, Your Health, Promotion, Prevention, and Positive Intervention. I'd also like to acknowledge the presence of the Deputy Governor, who's with us this evening. A matter of housekeeping, as those of you at the back get seated, those of you with mobile phones, I know we cannot live without them. I'll encourage you to put them on silent or vibrate. We'll have a bin passing around to collect fees if anybody's phone rings. Now that I have your attention with that, I would like to invite His Excellency the Governor Martin Roper to deliver welcome remarks. Governor Roper has been steadfast in his support of the efforts of the government and the medical community as they continue to work hard to keep the country and all of us safe. He has been a strong advocate of healthy living, of a healthy lifestyle, and I hear he runs on the beach every single day. Well, lucky for him, he has a prime spot to get onto the beach, if not every day, almost every day. And we're honored that he's able to join us this evening. Governor Roper.
Well, good evening, everyone. I haven't quite come up for air yet after absorbing the dramatic developments in the UK today, which I was just discussing with the Honourable Premier. In fact, he's been so successful at sorting out political shenanigans in Cayman, I'm thinking of sending him as a special representative to the UK to help us sort out a few problems over there, but he hasn't said yes yet. It is my distinct pleasure to welcome each of you to the 13th Annual Cayman Islands Healthcare Conference. And let me also say a warm welcome to our new Chief Medical Officer, Dr. Nick Gent, an outstanding appointment by Cayman. And thank you also to outgoing CMO, Dr. Ortilia Newton, for stepping in so impressively over the last year. I am so pleased that this important event has finally returned to its original 3-day format with no gathering or mask restrictions in place. Last year, we were poised to have a fully in-person conference when we had a serious outbreak of COVID-19 community spread. The organizers pivoted very quickly to a limited in-person virtual hybrid event. It seems a long time ago already. But thankfully, the situation is much different today, and here we are, safely and responsibly living with COVID-19 in our community, with access to the UK-supplied vaccines, boosters, and medicines, a fully reopened economy, and a tourism industry that is rebounding. So in this phase of living with COVID-19, it is important to remember to keep healthy, to practice good hygiene, get boosted for additional protection. And the flu season is upon us again, and we must remain vigilant about our self-care. At last year's conference, we talked about breathing easier in the COVID era, despite, ironically, all of us wearing masks. We looked at what that would and should look like physically, mentally, environmentally, and medically as we anticipated a full reopening of our borders. As it relates to our health, many people were distracted for the past 2.5 years by the pandemic, and understandably so. A lot of people did neglect their annual checkups or ignored new aches and pains, perhaps because they were just happy to be COVID-free. But now, at this year's conference, as our theme suggests, it's time to turn our attention back to our overall health and well-being, to start advocating for ourselves, taking the necessary steps to prevent poor health, asking the right questions, and taking action as soon as we believe something is wrong. And all the men in this room and out there know that that applies very much to them too. Now, non-communicable diseases, whether it's cancer, diabetes, chronic respiratory diseases, are often referred to as silent killers. And I am pleased that the organising committee has chosen to shine a light on these diseases and conditions at this year's conference and facilitate important discussions we need to have. The Caribbean continues to be one of the sub-regions of the world with the highest prevalence of NCDs, and at least half of all deaths annually in any Caribbean country happen as a result of NCDs. The economic burden of these chronic diseases and the effect on our society cannot be understated. It is devastating, and unfortunately, COVID-19 has only compounded the problem. I do applaud Minister Turner and her team in the Ministry of Health and Wellness on their commitment to make non-communicable diseases a focus and a priority. The significance of that decision will reverberate in generations of Caymanians to come, who will live in good health because of the steps taken today to prevent and decrease the incidence of NCDs in Cayman. All of us need to create a blueprint for our personal health that includes finding practical ways to improve health and well-being, reduce risk factors, and assemble a team of healthcare practitioners we can call on for guidance and care. Good health is a gift that we often take for granted until we no longer have it. I believe this conference will remind us just how important it is. Now, I believe this is my fourth attendance at this excellent conference, and most likely my last, as Lizzie and I will sadly be leaving at the end of March. This may be one of the last times I address the healthcare community as a group. So let me just say what an outstanding group of people all of you are, whether in the public sector or the private sector. You have helped our community come through COVID in great style and fashion, and I continue to argue that Cayman has had one of the best responses anywhere in the world to the pandemic. I was proud to play a part in that myself. Thank you. I was proud to play a part in that myself, not least in ensuring UK-supplied vaccines, boosters, medicines, PCR testing capability, and expertise was available to Cayman. It undoubtedly helped us save many hundreds of precious lives. But all of you played an outstanding part in what I believe was a brilliant Team Cayman effort. And I know that Minister Turner has tremendous focus and vision to take healthcare in Cayman to a new level in the coming years. And she is building a really first-class team of people around her to help deliver that vision. And I do want to wish her every success. So thank you very much, and I hope that you all have a truly wonderful conference. Thank you.
Thank you very much, Governor Roper. Now, we were just discussing that this has become an annual get-together for us. Sadly, won't be having you with us next year. Maybe we could invite you as a special guest, possibly. Now, before we move on, I would like to say thank you to our top sponsors: Health City Cayman Islands, Integra Healthcare, Doctors Hospital, the Cayman Islands Health Services Authority, Compass Media, Iron Shore, Cayman Hearing Center, and Kelly Holding Events and Communications. Without the support of these entities, we would not be able to be hosting this conference here this week at no cost to the general public. So we say thank you very much to our sponsors. I would now like to invite the Minister for Health and Wellness, the Honorable Sabrina Turner, to deliver opening remarks. Since taking office, Minister Turner has been working tirelessly to keep us informed and safe as we navigate this post-COVID era. We are grateful for her leadership, her commitment to health and wellness, and for making this conference a reality. Minister Turner, welcome.
Good evening, everyone, and welcome. It's usually a hard act to follow, coming after His Excellency the Governor, because he has these little icebreakers that, sometimes I really wonder where he gets it from. But he didn't use much of those tonight on me, but he took a few of my lines. So I'll have to double-check his office to see really what's going on. But it is indeed my pleasure to add my welcome to His Excellencies and to thank everyone for being a part of this event. It's amazing how he said he has not yet come up for air, but last year theme was breathe easy. And I can assure you tonight you can breathe easier because we are the Cayman Islands. On behalf of the Ministry of Health and Wellness, I would like to welcome you all to the 13th Annual Cayman Islands Health Conference. As I've said in many familiar settings, taking my office, it is my aim as your Minister for Health and Wellness to promote and facilitate healthy behaviors that will result in healthier, happier, and more resilient individuals, families, and communities. I'm so happy that the Governor has the beach to go on. We are blessed that it's ours, and we're happy to share it. It is this government's vision to see our citizens thriving, and no matter what your definition of that may be, health and wellness is certainly a key component of that goal. Now, achieving this goal means working together to help create and culture and advocacy and empowerment of our personal health needs. Advocacy begins by asking ourselves and our medical practitioners the important and at times the very difficult health-related questions. One of the biggest fears that we face is self-diagnosing. Fear of how you may be perceived when you don't have sufficient funds in your pocket to go and seek help. How will you be looked at if you go in and don't have medical insurance coverage? We must put a stop to that. Empowerment is our ability to accept and act on the answers we receive and take those positive steps that will lead us to better health. Now, we often speak about empowerment and the need for each of us to be willing and be able to advocate for our personal health. But rarely are we given the necessary tools to take the necessary action. I am happy to say this evening that this year's conference, Your Health, Promotion, Prevention, Positive Intervention, is just a step to bridge that gap. As we transition to living safely and responsibly with COVID-19, in acknowledging that 2022, we are no longer in the same position that we were 2 years ago. It is time for us to turn our attention to the health threats that we have dismissed or just outright ignored. According to the Center for Disease Control and Prevention and the World Health Organization, non-communicable diseases such as heart disease, cancer, chronic respiratory disease, and diabetes are the leading cause of death worldwide and represents an emerging global health threat. Deaths from non-communicable disease now exceed all communicable diseases, deaths combined. Non-communicable diseases kill 41 million people each year. Now think about that. Equivalent to over 7 out of 10 deaths worldwide. Now closer to home, non-communicable disease have had a significant and devastating impact on our Cayman community for decades. Far too many of us have had firsthand experiences with or supported loved ones who have battled cancer, heart disease, and stroke, all of which can result in long-term health consequences and often create a need for long-term treatment and care. It is for that reason that my Ministry of Health and Wellness, has shifted its focus to strengthening public health nationally. And in so doing, we are spotlighting non-communicable diseases. If ours is to be a proactive approach aimed at protecting, promoting, and improving the lives, health, and wellness of families and communities, then the prevention of non-communicable disease must become a national priority. It must become a national priority. And our efforts to reach that goal begins today. The Health Conference Committee has collaborated with the public and private sector colleagues, as well as international partners, to put together a comprehensive, relevant, informative agenda that will address the global epidemic of non-communicable diseases. Our experts, speakers, and panelists that are expected to grace us with their presence at this event will also be able to shed some light on key and painstaking reality. We will also learn how the prevalence of non-communicable diseases in the Cayman Islands affects our families, the society, economy, and our healthcare system. Now, the burden is shared by every one of us, regardless of one's health status. Our agenda, as you can see, is jam-packed this year. Being oversubscribed, our ministry, I am proud to say, were reached out by other ministers of health in the region, not only wanting to attend, but also wanting to participate. And I think we have to give ourselves a round of applause when they're inviting themselves. In 2020, the World Health Organization released a list of 13 urgent global health challenges that the world will face over the next decade. They include climate change, equality in healthcare, access to healthcare and treatments, infectious disease prevention, epidemic preparedness, underinvestment in health workers. Now, this needs to be repeated. Underinvestment in health workers. Improving public trust of healthcare workers and adolescent safety. The time has come to have the real conversation. Is it non-clinical expenses and clinical expenses, or it's time to get that balance right? Let's see what we can do. And definitely, we are well on track at getting that all at a level playing field. Now, when we talk about epidemic preparedness, the underinvestment in healthcare workers, that also includes improving the public trust of healthcare workers and adolescent safety. Professor Ian Cummings, the UK Ambassador for Healthcare and the Overseas Territories, joins us virtually tonight to help us better understand how these challenges will affect us here in the Cayman Islands. Now, Professor Cummings will cover the global drivers of change of healthcare, focusing on demographic changes, the global economy, workforce technology advances, and public patient expectations, and how these may affect the planning and delivery of healthcare right here in the Cayman Islands. Please remember, clinicians, we have your internal customers and your external customers. And if we're going to do this from a national level, it doesn't matter whether you're HSA, Health City Cayman Islands, or one of the private firms, we're all in this together. Thank you. Have you ever wondered about the national prevalence of chronic disease and the prevalence of risk factors for chronic disease right here in Cayman? Are you interested in learning more about the work underway to develop and strengthen the surveillance of chronic non-communicable diseases. Now, our national epidemiologist for the Ministry of Health and Wellness, Ms. Rachel Corbett, will be sharing answers to these questions during her presentation. And I'm so pleased that we now have an epidemiologist in the ministry, definitely representing us nationally. If you're interested in gaining insight into the demographic and socioeconomic factors that increase the risk of developing chronic diseases and the implications for the Cayman Islands in context of the 2021 census demographic and socioeconomic data, then Ms. Fiona McDougall, owner and director of Healthy Features Limited, has the information you're seeking. Ms. McDougall will also present on innovative chronic disease management models that countries like the United States, Canada, and the United Kingdom are using, and hear about the repercussions and opportunities for primary care, community care, long-term care, and mental health care here in the Cayman Islands. Cardiovascular disease is the leading cause of death in the Americas. And Dr. Ravi, international cardiologist, senior adult cardiologist, and psychologist of Health City Cayman Islands, will discuss newer markets and trends for cardiovascular risk assessment and risk markers in women, and the data which shows that these are working. Genomic sequencing is providing doctors with much data about causes of cancer and changing the way some forms of the disease are treated. Now, Dr. Lundy Richards, consultant, medical hematologist, oncologist, and Mr. Jonathan Smelly, principal biologist, both from the Cayman Islands Health Services Authority, will also speak on the topic of genomic sequencing for cancer diagnosis and therapy. I'm very interested to hear how the team at the Health Services Authority is using this technology to help cancer patients right here in the Cayman Islands. From cancer, we move on to the two other non-communicable diseases, stroke and dementia. Dr. Azad, neurologist and neuropsychologist of Doctors Hospital, will tackle these non-communicable diseases, which represents a growing healthcare burden as more Caymanians move into the higher risk age groups over the next couple of decades. How are we measuring in strokes and dementia here in the Cayman Islands? What steps are we taking to prevent these diseases? Now, Dr. Isaac will provide some insights to these questions. If I ask the question here this evening, how many of us in this room are taking prescribed medication or some type of supplement to improve our health? I know the men don't believe in multivitamins, yet they wake up many times, I'm not saying this to the Premier, and say that they're tired. Just our little secret. Now, I would venture to say that almost all of us here would raise our hands. Now, pills are perhaps the easiest way to handle an illness, but are they making us healthier or sicker? Don't bail out. How many of us? Well, I'm pleased to say that Dr. Lynn Harris, Chief Lymphoma Services at the Miami Cancer Institute at Baptist Health South Florida, will tackle the topic of optimizing our health without medications, but instead through lifestyle modifications. This is such a worthwhile subject to explore, and I'm quite sure our governor has no problem loaning us his portion of the beach. Remember, there is a high water mark. Let's talk about burnout. And I think there's only about 3 politicians in here. We will not go there. I think we would all agree that the COVID-19 pandemic introduced new stressors to every part of our lives, from the workplace and classroom to the family unit and definitely finances. Longer work hours, more demands at home, increased cost of living factors. We're not mentioning CUC. They can all contribute to mental disorders, even in those persons who never struggled with mental health before. Now, Raquel Tobiad, clinical social worker and chemical dependency counselor, and Derek Oliver, psychologist, licensed therapist, and board-certified behavior analyst, both of Infinite Mind Care, will speak on this very topic, from burnout to totally checked in, understanding burnout and moving from coping to resilience. One of the stumbling blocks to effect disease control, according to research, is the gap between testing and delivery of results, which often cause patients to lose interest in pursuing further care. Now, Professor Andrew Shaw, Associate Professor with Physical Chemistry at University Exeter and founder of Automaker Limited, will present on the evolving role of point-of-care testing in prevention and positive intervention in non-communicable diseases. Professor Shaw and his team have come up with innovative ways to close that gap by introducing both testing and results at the point of care. That is, within the initial consultation. So all of you men that your wives are telling you go for that checkup, we have found a way to get you there, keep you there, and you get the results. Can I get a round of applause from all of those women who are trying to get them there? Now, I am excited to hear more about how this has improved the detection and management of non-communicable disease. Our first panel discussion will address topics such as my health, my responsibility, keeping women well through the ages, the challenge with men's health, and from identification to intervention in the same consultation. The Building Better Health for Self panel sponsored by Integra Healthcare Limited will feature the team from Integra, Mr. Andrew Vincent, founding director, Dr. Lisa Joels, OB/GYN, and Dr. Francisco Martinez, general practitioner and family physician, alongside Professor Shaw. One topic that requires more attention is perinatal mental health. According to NHS England, perinatal mental illness affects up to 27% of new and expectant mothers in the United Kingdom. Now, that percentage may be higher, but sadly, a stigma still persists surrounding mental health. For women specifically, new mothers, feelings of depression, anxiety, obsessive-compulsive disorder, and postpartum psychosis often evokes feeling of guilt and shame, which force them to suffer in silence. Dr. Walton, clinical psychologist at the Wellness Center, will shed some much-needed light on this very important topic. How much thought do you give to your teeth? I am petrified of dentists. My blood pressure skyrockets even for a dental cleaning. Well, after reading this and definitely doing some research myself, oral health is probably not the first thing that comes to mind when tackling non-communicable diseases. But in August of 2021, the World Health Organization prepared a draft global strategy on tackling oral disease and linked oral health and non-communicable diseases by recognizing the common risk factors for oral diseases and other non-communicable diseases. Oral health is a key indicator of general health, well-being, and quality of life. Dr. Wilbert, general dentist at Dr. Wolf's Dental Center, will explore the topic of dental health in his presentation. Your teeth are meant to last a lifetime. Prevention, detection, health consequences, and treatment mobilities. Our closing panel moderator, Dr. Delroy Jefferson, Medical Director at the Cayman Islands Health Services, will tackle the topic Advances in Cancer, Diagnosis, Monitoring, and Management. Dr. Lundy Richards, Consultant Medical Hematologist Oncologist at the Cayman Islands Health Services, Dr. Courtney Cummings, Deputy Medical Director at the Cayman Islands Health Services, and Dr. Darley Solomon, Attending General Surgeon at Doctors Hospital, and Dr. Benoit, Consultant Medical Oncologist at the Health City Cayman Islands, will share their extensive individual, collective experience and expertise. And I know we will be all better for it, and definitely looking forward to hear those discussions coming out from that panel. Now, I hope that you are as impressed as I am with the variety of perspectives being presented at this year's conference. There is something for everyone, and I am sure that we will be enlightened, moved, entertained, and challenged. I am pleased that our new Chief Medical Officer, Dr. Nick Gent, who has joined the ministry just this month. I was wondering, because coming tomorrow, he'll be here 10 days, and I went in there on Tuesday, and I saw him in his office, and I said, oh God, please don't bail on me now. But I'm happy he's still with us. He will provide us with some closing remarks this evening, and Dr. Gent is highly experienced public health doctor who comes to us from the United Kingdom Security Agency, where he has held the post of Senior Medical Advisor and Consultant in Public Health for the past 20 years. Working principally in the field of chemical, biological, radiological, and nuclear threats, and the management of major incidents, and server of public health threats as well. We are lucky to have him on our team as we navigate the post-COVID-19 era. I also would like to take this opportunity to thank our sponsors for helping us make this year's conference a reality. Dr. Benoit, Clinical Director and Senior Cardiothoracic and Vascular Surgeon, will bring remarks on behalf of the Health City Cayman Islands, the conference main sponsor. Health City is a longtime supporter of this event, and over the years has provided dynamic speakers who always bring a wealth of knowledge and experience to the discourse that takes place at this conference. We know that budgets continue to be stretched to their limits, so we appreciate the support that all of our local and international sponsors have given us to improve this event. Thank you. To our esteemed speakers and panelists, both local and those joining us from overseas, thank you for being here and to share your research, knowledge, and experience with us throughout the next couple of days. Your input is invaluable, and we look forward to hearing from each of you. The politician in me, and I can tell you, honestly, finally, to you, the attendees here this evening, thank you for making this investment in your health and committing to enhance your lives and the lives of the loved ones by seeking out valuable information that will help each of you succeed. Ladies and gentlemen, at your service, thank you for your time, attention. Enjoy the conference, and God bless.